When we make sure Black women are included, we gain a more accurate picture of health, we can design better care, and then we take a real step towards closing the health equity gap.
That's Manraj Kaur from Brigham and Women's Hospital and Harvard Medical School. You'll hear more from her up next. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. Historically, Black women have been underrepresented in clinical data collection. To help oncologists better understand these patients' experiences with symptoms and treatment side effects, ACCC has partnered with Brigham and Women's Hospital and Harvard Medical School on the IMPROVE study. Here to tell us more about the study is Dr. Andrea Pusic from Brigham and Women's Hospital and Harvard Medical School.
Patient-reported outcomes, or PROs, are things that only patients can know and tell us about. These are things like symptoms, like pain or fatigue, or aspects of quality of life, like physical function. PROs can help us in terms of how we take care of patients by letting us know how patients are feeling and functioning, and we can better address their needs.
Where are PROs measured?
So systems that are set up to regularly measure patient-reported outcomes using specially designed measurement tools called PROMs, or patient-reported outcome measures, generally exist in large academic healthcare centers or large cancer centers. And what that means is that women receiving care in these large academic centers are the ones who benefit most from routine monitoring of patient-reported outcomes. And their providers are most able to address their needs in real time.
Walk us through why Black women are underrepresented here.
So many Black women may receive their breast cancer care in community cancer centers that may not have the resources or the bandwidth to have established systems for routine measurement of patient-reported outcomes. Without those systems in place, then patients are not being routinely asked and routinely monitored in terms of their quality of life and their symptom burden, which means then that their providers may be unaware that they are suffering, that they have a decrease in physical function, that perhaps their symptoms related to their chemotherapy have worsened. And with that, their provider may not be able to adjust their treatment or provide the additional care that would help them have better outcomes and better experiences.
How does the study work to address the disparity?
So the IMPROVE study is all about increasing accessibility of patient-reported outcome measurements to Black breast cancer patients receiving care in community cancer centers. So at the Brigham and Women's Hospital, we developed a system and approach to measuring patient-reported outcome measurement in Black breast cancer patients. And we had a lot of input from community members and from other Black breast cancer patients. But we wanted to see how that could be scaled more broadly into settings that have lower resources and that don't have as many people perhaps working in the clinic or as much bandwidth to be able to set up and stand up and maintain this kind of program. It's about scaling and spreading patient-reported outcome measurement to 5 community cancer centers serving primarily Black breast cancer patients. And in that, we're learning just a tremendous amount about the different challenges, the barriers, but also some of the facilitators and also some of the great desire and energy of people working in these centers and of the Black breast cancer patients who really want to engage in this work and be part of the expansion of patient-reported outcome measurement.
What has boosted ePRO engagement?
We've identified a number of facilitators. One is local champions. It creates enthusiasm. It improves communication about what the program's about. And also it engages folks in an environment of trust and an understanding that this is about trying to improve outcomes and being present and responsive to the needs of these women as they go through treatment. We've heard from our patient partners that access to resources that are developed in such a way that they're really easily understandable and really resonate with this patient population have been helpful. So as an example, in our IMPROVE program, in response to, say, a woman answering questions about physical function, say after radiation, she might then be able to click on a resource around physical therapy or stretching exercises. What we've heard is that it's better to provide those resources in a video format, maybe delivered by, say, a Black nurse or a member of the community talking about stretching exercises that makes it feel more relatable and relevant to her specifically.
Talk to the cancer team. What would you like them to know about this patient population?
There are unique challenges to receiving care in a community cancer center, and there are unique challenges to managing the breast cancer journey for Black breast cancer patients, many of whom have additional challenges in terms of resources and work constraints and family issues. Putting all that together, though, we need to come together as a cancer care community to be able to help overcome some of the obstacles to PRO measurement because these are the patients who need it most. And these are the places where providers need the most efficient systems, where they need to be able to understand how their patients are doing to be able to really help them receive the care that they need and ultimately have the best quality of life and functional outcomes.
We're listening to this show and we want to do the best for our patients. We want to give them the care they need and have the best outcomes possible. What do we do now? What can we look at in our own centers?
If you're an institution that already has a patient-reported outcome measurement system, I would say look at what you've got and ask yourself, is it really accessible to everyone? I think sometimes systems are set up so that even in a well-resourced setting, there will be missing voices. And those missing voices may be patients that have lower health literacy, that may have some concerns around trust around how the data is being used, that may have less access to electronic devices and may require, say, an iPad in the clinic because they don't have a smartphone. So even in well-resourced settings, I would encourage all institutions to be thinking about how much equity there is in their patient-reported outcome systems and that are there perhaps missing voices. I think for other sites that don't have patient-reported outcome systems and are looking to develop them, and I would look to this experience and what we want to be able to be inclusive of everyone. So from the get-go, be thinking about how your systems could be set up such that there's equitable collection of patient-reported outcomes such that all patients receive the benefits of this approach to patient care.
You heard from Manraj Kaur at the top of the show. She's here to share how her team is preparing for the IMPROVE study.
So the first phase of this work, which was completed over the last year, was essentially laying the groundwork for implementing IMPROVE, which is the web-based application for assessing PROs in breast cancer. So what we did was we visited each of the 5 sites that are engaged in this study to get a feel for how the clinics operate. Once we were done with the visits, we also conducted interviews with clinical staff. So these were administrative staffs, nurses, social workers, and even touched base with IT teams on the side to really understand their perspective on clinic workflows, technology integration, and any barriers that they can envision. To make it as comprehensive as possible, we interviewed patients to understand their experiences, preferences, and any concerns related to PROs, so things like privacy, communication. And we are specifically focusing on Black women with breast cancer in this research. So we were intentional about recruiting Black women with different ages, education levels, and socioeconomic status. So the goal really here with patient interviews was to capture insights on what would make PROs useful and accessible for them. There's a last piece that we are still trying to wrap up for the first phase of this research, and that's community engagement. So what we are doing with this piece is working with leaders from Black-centered breast cancer advocacy groups, organizations, or really like community leaders who are operating solo, but are deeply connected to communities that we are studying. And these focus groups essentially are small facilitated discussions to explore external factors that drive PRO engagement. And this feedback has been invaluable so far because they bring a really broad perspective on what drives patient engagement and how healthcare systems can better support their community. The data that we'll collect from these activities, site visits, clinical staff focus groups, patient focus groups, and community leaders will guide the development of our next phase of research, where we actually launch the app in clinics and develop training materials as we do that.
What was your main takeaways from these interactions, the site visits and the interviews?
Yeah, so I'll focus on 2, the clinical staff and the patient focus groups. The results so far have been fascinating and very, very informative. So let's start with the clinical staff focus groups. One thing that has stood out to us is how each site that is participating in this study is unique in its workflows and challenges, but at the same time, there are overarching similarities. And this sort of helps us understand how these dynamics between the staff members and how the clinic is organized and run impacts readiness for implementation and sustaining the implementation of PRO data collection. The patient interviews have also offered some really powerful insights. One recurring theme that comes to mind is that patients truly valued knowing their providers are looking at their PRO results, and they thought of IMPROVE as a way to facilitate meaningful discussions during their visits. One of the features of the improved web app is resources, and we've been receiving very positive feedback on it. So it's essentially like a favorite feature of the app. It provides patients with practical information on various aspects of their cancer journey. So things like managing pain, staying physically active, understanding what to expect during chemotherapy. And it's become very clear very quickly that these resources are helping patients feel more informed and supported. So, these results are showing not just what's working, but also where we need to focus as we refine the implementation models and tailor them to each site.
What are ePROs and how do they impact Black women in particular?
So they're essentially digital versions of patient-reported outcome surveys or prompts that we talked about earlier. So instead of filling out a paper form in a waiting room, patients can answer questions about their health from their phone, tablet, computer. So it sounds super convenient, right? The biggest challenge that we've heard from our patients and clinical staff, and something that we kind of anticipated going into this, was technology access and illiteracy, essentially. So we know that because of all the systemic discrimination that has occurred with the Black patient population in the past and to this date tends to occur in a lot of health systems, has had these downstream effects on the social capital that they hold in the society, the amount of resources that are available to them. So when we launched this study, that was something that was very front and center for us to sort of understand how we could overcome those barriers and make sure that Improve is working for all and not just like, a subgroup of Black women with breast cancer who have access to a smartphone, for example, or who are technology literate or who have access to like data plans to access the app. So we've sort of like brainstorm things like, having iPads available at the clinic for women who are unable to complete these surveys at home, sort of to level the playing field a little bit.
You touched upon this, but I'd like to hear more. How did your team make sure the program met the needs of Black patients?
PROs are all about, as I mentioned before, understanding how someone feels, functions, and lives while managing their health condition, in this case, breast cancer, or undergoing treatment. We were like especially zoning in on the concerns of Black women with breast cancer was we conducted interviews when we were designing the Improve app to make sure it had usability features that were accessible. We've sort of gotten feedback on the surveys or questionnaires that are included in this app. And we're also hearing a lot of concerns. So, Black women with breast cancer are saying things like, in past, different types of surveys, not PROs, have been used to limit the type of care that they receive, or also has been used against them in terms of sort of blocking financial resources that may be available to them in the community. So that has been important for us to learn, that the mistrust that has been in the community transcends into the work we do at every level.
Why do you think your colleagues should be taking an interest in initiatives like this, like an improved platform?
Underrepresentation in research has been shown to affect trust. So, for example, if Black women don't see themselves or their experiences reflected in studies, it can make them feel like the system isn't really for them. And that mistrust not only has, devastating impacts on their health. So, for example, delaying care, but it can also discourage future participation in research, creating this like cycle of exclusion, which takes a lot of effort to break. So it's really, like representation does really matter at every level. When we make sure Black women are included, it's not just about fairness, it's about building healthcare systems that actually work for everyone. We gain a more accurate picture of health, we can design better care, and then we take a real step towards closing the health equity gap.
Thank you to our guests today. You can take a look at the show notes for more on the Improve study and bridging the gap in patient-reported outcomes data. The conversation doesn't end here. We hope you share this episode with a colleague in the community cancer care setting. Until next time, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.